Hi everyone, welcome to Dental Exam Guide, and today's topic was formulae for mammalian teeth. It is an important short note question and you can get the question as narrate the dental formula for permanent and deciduous teeth. Dental formula is the expression of the number of teeth of each kind in one half of the upper and lower jaw. Or it is a graphic representation that indicates the number of teeth that a certain species has. All the mammalian teeth are expressed by formulae and it helps to differentiate human dentition from that of other species. Dental formula usually have three parts. First one is an alphabet which indicates the different classes of teeth and it is represented by first letter in their name. Letter I is used to represent incisors, C for canines, P for premolars and M for molars. Each letter is followed by a horizontal line and the number of types of tooth in each class is written above the horizontal line for maxillary teeth and below the line for mandibular teeth. Dental formula is present only in the mammals because in them differentiation can be made in shape, position and function of teeth. And there is no dental formula in fish, amphibians and reptiles. If we draw an imaginary line along the midline of our face, we can divide the dental arches into right and left sides. As the teeth in right and left side are usually equal in number, dental formula represents teeth on only one side. If we multiply the number of teeth in the dental formula with 2, we will get the total number of teeth present. This is the dental formula of our permanent dentition. It should be read as incisors 2 maxillary and 2 mandibular, canine 1 maxillary and 1 mandibular, premolars 2 maxillary and 2 mandibular, molars 3 maxillary and 3 mandibular, 16 altogether on one side, right or left. So we can see here there are 2 incisors in the upper arch, central and lateral, and 2 incisors in the lower arch, central and lateral. So we can write I 2 by 2. Similarly, 1 canine in the upper arch and 1 in the lower arch, so C 1 by 1. 2 premolars in the upper arch and 2 in the lower arch, 3 molars in the upper arch and 3 in the lower arch. Altogether, one side of our dentition will contain 16 teeth. In our primary dentition, premolars are missing and we have only 2 molars. So we can write the dental formula as I 2 by 2, C 1 by 1, M 2 by 2, altogether 10 teeth on one side. Anthropologists also use the notations like DI1 and DI2 for deciduous first and second incisors, DC for canines, DM1 and DM2 for deciduous first and second molars. Similarly, for permanent teeth, they use capital letter I1, I2 for first and second incisors, capital letter C for canine, P1, P2 for premolars, M1, M2, M3 for molars. But these kind of notations are usually limited to anthropological tables due to keyboard incompatibility. If we compare the dental formulas of different species, we can see that dental formula is similar in nearby species. Among the current mammals, the largest number of teeth has the dental formula of 3143. Total teeth present is 44. That's all about dental formula, and now I will discuss few MCQs. First question is, humans are classified as having which type of dentition? We have already discussed in our previous videos that humans have teeth with different morphology. So humans are heterodont and we have 2 successive sets of teeth during our lifetime. So we are diffeodont. The answer is option B. Next question is, calcification of permanent tooth begins at what time? And the calcification of the first permanent tooth, that is first permanent molars, begins at birth. So the answer is C. And by the age of 3, all the permanent molars will complete their calcification. Calcification of all the primary teeth begins even before the birth of the baby. Even the last primary tooth begins the calcification by 19th week. Now 3 similar questions are there. Which is the first permanent tooth to erupt? Which is the first succedaneous tooth to erupt? And which is the last succedaneous tooth to erupt? All these I have discussed in the previous videos. First permanent tooth to erupt is permanent mandibular first molar. First succedaneous tooth to erupt is permanent mandibular central incisor. And the last succedaneous tooth to erupt is maxillary canine. But the last permanent tooth to erupt are wisdom tooth, that is third molars. Next question is a simple one. How many premolars are found in each quadrant of a normal deciduous dentition? The answer is 0 because premolars are not present in deciduous dentition. Next question is, average time period a permanent tooth take to completely form is? Complete formation means it is the time from the beginning of calcification till the completion of root formation. Even after the eruption, permanent tooth take almost 2 to 3 years for the completion of their root formation. And the average time period required from the beginning of calcification till the completion of root formation is almost 8 years. Next question is, number of teeth seen on an X-ray at birth. That means if you take a full mouth radiograph of a newborn child, how many teeth you would be able to see. A tooth must be calcified for it to be visible in an X-ray. So we know all the 20 primary teeth completes their calcification even before the birth. And at birth, all the 4 first permanent molars are also getting calcified. So the total number of teeth seen in an X-ray of a newborn child is 20 primary teeth plus 4 permanent molars. So 24. Next question is, the root resorption, that is in primary teeth, is started after how many years of formation? Primary teeth roots are getting resorbed before their exfoliation, and the time taken for resorption is almost 1 to 2 years after complete formation of their roots. This average time is 1.5 years. Next question is, what is the root completion time of a permanent tooth? Permanent tooth need almost 2 to 3 years for completing their root formation after erupting into the oral cavity.